Hi, I'm John Walkup. I'm a child and adolescent psychiatrist, and I have a number of different roles. I'm the president of the American Academy of Child and Adolescent Psychiatry, but I'm also the chair of the Pritzker Department of Psychiatry and Behavioral Health at Lurie Children's Hospital in Chicago. Well, I think it's important to understand that, yes, there is a shortage, but the real issue is the size of the demand. That really what we're talking about is 20% of kids in any given year will have a mental health problem. And most of the mental health problems actually begin in childhood and adolescence. And pediatricians are really the front line for that. So many medical problems that pediatricians deal with, they have prevalence rates that are much, much lower than that. And so, we can plan and create a scope of work for low prevalence problems. But when we have a high prevalence problem like behavioral health challenges, it's very difficult to plan for a workforce to really address that challenge. And so, child psychiatry and pediatrics, we have to work together to address that challenge. Well, what we've been trying to do at Lurie Children's is we've been trying to get pediatricians to really get to this stuff much, much earlier. And so that when they come to a child psychiatrist, the family's a little better prepared. I'll give you an example. So we're actually, are you ready? We're encouraging pediatricians to take a family history at the first well baby visit because we know that family history of psychiatric problems is really one of the determinable risk factors for future problems in kids. And we also ask them to begin as early as possible talking about parenting capacity because we know the capacity to have a good parenting within the home, good structure, good predictability, good discipline practices are really effective in helping kids prevent the preventable behavioral problems. So by starting early, the pediatricians can really get on top of this stuff and then begin to do the anticipatory guidance based on family history and other family risks. And so when it comes time to see a psychiatrist, the family is fully prepared. I see kids after they've been in the system for years. They've had early challenges, early problems, they've seen other people. Um, and I think pediatricians, because they're on the front lines, have a chance to start that process much, much earlier so that that transition actually is much, much smoother. If they wait, then it's awkward. They may have known something was going on for years, and then the family kind of says, "Well, I think we need to do something." Then if the pediatrician then responds at that moment, it's kind of late in the game. So I think getting to them early through that pediatric practice is really the best way forward. Yeah, I think again the crises are almost predictable if you're doing the kind of work that I'm suggesting. So we know that those risk factors, like kind of environmental management or parenting practices and family psychiatric history, the genetics, if you will, those kinds of things can be known early and can be anticipated and discussed early. And we also know the age of onset of all the conditions that we have treatments for. So we know autism often begins between 0 and 3, particularly if it's moderate to more severe. ADHD starts before age 7. The anxiety disorders start between 6 and 12. Um, Depression and the psychotic disorders start in the mid to late teens. So if you know the family history, and you know the age of onset, then the pediatrician can predictably begin to work with the family and in general begin to forestall any kind of crisis, if you will, due to the lack of early engagement.